Hello, my name is Robin Overton. As a nurse, I have 13 years experience in addiction treatment medicine, and I also have 5 years in correctional medicine. Um, with that, I have seen how drug use affects the incarceration rate. Illegal drug use is one of the leading causes of incarceration. Addicts are not bad people, they are normal people with chronic illness. Drug addiction should be decriminalized because it is a chronic illness and because of the psychological and physical changes it has on the brain and the body. There are a few common misconceptions about drug addiction. One common misconception is that all drug addicts want to be drug addicts. That's simply not true. As an addiction treatment nurse, I encountered several addicts that would literally cry because they felt like they had a ball and chain connected to them with their addiction. I had one addict try to stop cold turkey on her own, and she ended up hospitalized. So it is a choice to some degree, but then psychologically, physiologically, it becomes no longer a choice. Another misconception is um, that they just started using drugs. That's simply not true as well. Most drug addiction started with legitimate medical issues or injuries. It takes less than 3 months of a legitimate use of opioids before you become addicted. I had a patient that went to the doctor after a car wreck. She was under the care of a physician. She went in, he would write her medicine, write her script for 30 days. She would come back in 30 days, see him, like everything was okay. She took the medicine as prescribed, like he told her. She never had to go out and buy any extra or anything like that. She just simply took what her doctor told her. She eventually went in one day and he told her that he could no longer write her scripts. And she said that was when she realized that she had a problem. It was then when she was faced with not having the drug that she realized that her symptoms, her pain was coming from the drug use. Um, Drug use changes the chemical makeup of the brain. So, with the chemical makeup being changed, the receptors being damaged, it causes changes in behavior and the way one thinks. Inmates make up 50% of, I'm sorry, 50% of all inmates are clinically addicted. There are several reasons why drug addiction is directly related to crime. Um, there are drug addicts that go out and commit crimes like stealing from family members or robbing stores or stealing copper from houses to go in and get money to fund their drug habit. Another crime that's related directly to drug usage is the actual trafficking of drugs, which again goes back to being able to fund and supply themselves with the drugs. Um, and also just the lifestyle that they live predisposes them to criminal activity. Um, Drug use alone, if it's not a prescription, is illegal, so they're already fighting an uphill battle with that. So if you are around people that can get you the drugs, more than likely you're going to be around criminal activity and become generally a product of your environment. People tend to commit crimes for their drugs simply because they want to avoid the withdrawal symptoms. The withdrawal symptoms can be from mild to moderate. Withdrawal symptoms generally can start as early as 3 hours after usage. Um, so, some withdrawal symptoms are diarrhea, nausea, vomiting, headaches, chills, bony joint aches, hallucinations, agitations, anxiety, increased heart rate, increased blood pressure, sweating, um, goosebumps. And so, with all of those things, they get desperate to stop the pain, to stop the anxiety. Many addicts, the minute before they even go into withdrawals, when they know that they may not be able to get their medicine or drug, the anxiety kicks in almost instantly, and they're tearful and they are lashing out because they know that if they don't take this, that they're going to be sick. What do we do if we have a headache? We take Tylenol. What do we do if our stomach is hurting? We take something for our stomach. So this goes into why someone would get desperate enough if those mild symptoms we take Tylenol. Just imagine those symptoms times 10, and then you can begin to understand why someone would be desperate enough to commit a crime in order to get money to fund their addiction. Drug addiction should be decriminalized because it's a chronic illness. I feel as though if we focus on the individual and the different treatment methods, we can focus on healthy treatment, healthy intensive therapy, and we can begin to get them on the road to recovery. They can recover, it's just a long road, and it has to be an intense process for it to be successful. I feel like if we can successfully work with addicts to begin to fix the drug addiction and get to the root of the problem, then we will then see a decrease in crime, because if you decrease drug usage, then you decrease the need to go out and steal from your family members, or to rob a store, or to sell drugs, or to rob banks, or anything of that nature. I feel like if we can focus on the treatment and not incarceration, then we can return these members of society back into productive members of society, and they can go and regain their life back instead of sitting in the penal system and never really recovering. Thank you.
Thanks.